All right. Good evening, friends. Good evening, Aparajita. And today we are here to discuss the 3-2-1 strategy for INI-CET November 2024. We all know that the exam is on 10th November. I am sure you all have filled your forms with the choice of the city that you want to give your exam into. You have completed the payment and your final registration after EUC and all the other formalities is over. All those who are still not done with it, please don't wait for the last day. Finish whatever you want to finish for form filling within 1 or 2 days. All right, don't make it in the last days. And one second. Just getting back to the session. Yes. So it is just 3 weeks to go. Okay, I don't consider last 2-3 days into the study schedule because it's such a big exam that in the last 2 days you should only think about just brushing up whatever last minute things you have to brush up, and you can spend that time very, very crucially to travel. All those who have the centers in the same city, it's okay. But if you have your center outside your town, outside your city to some other city, you should make sure that you travel to that city 1 day before the exam and not on the day of exam. So travel 1 day before, settle down, and what needs to be done now in the last 3 weeks? I'm just going to tell you that now. So what is this 3-2-1 strategy? 3 is 3 important points which you have to remember. SS, TT, ST. To remember 3 very, very important points, and they are SS, TT and ST. I will tell you what they are. What is 2? You have to do 2 revisions. How will you do 2 revisions? I'm going to tell you in this strategy. And one is that one mantra which you have to follow to get a rank. This is not a pass or fail exam. This is a ranked exam. Last year, around 32 seats were available in the INI-CETs for the MDS segment in general category. A little more for other segments. So it's all together a game of around 50 seats, and it can be you. So don't worry, prepare very, very nicely. Most of you have completed your first reading of all the 19 subjects, including anesthesia. Some of you have also done half of your second revisions, and most of you are in the midway of your second readings. So if you are really targeting INI-CET, this strategy will help you for those last minute preparations. If you have any doubts, you can put your doubts in the chat sections of our live chat, and I'll be taking your doubts in the end. So let's see one by one what are the 3-2-1. 3 important points. What is SS? Make your strength stronger. What does this mean? If you feel that out of 19 subjects, you are good in 12 subjects, okay, and not so good in 7 subjects, this is the time to focus on these 12 strong subjects to ensure that no question, at least no repeated question, should be wrong in these 12 subjects which you like, which are strong. So for example, if you feel that, okay, I like ortho, I mean, your ortho is good, your oral surgery is good, your medicine is good, your prostho is good, but maybe DADH is not that good, or biochem is not that good, or oral surgery is not that good. Ideally, all the 19 subjects should be strong, but we are all humans, okay, and it is not possible that each and every subject it's a perfect. So whatever are your strong subjects, whatever is your strength, This is the time to make your strength stronger. Pay more attention to the subjects, to the questions which you know, which you have done, and which you can answer correctly. Silly mistakes in these strong subjects, a rank slips out of your hands. So remember, whatever subjects are your strength, pay most attention, and it is equal weightage. I will not say that give more attention to the basics, more attention to clinical. I would say yes, dental clinical are very, very important. But whatever is your strength, at this time, make it stronger. So that's the first important point which I would want to tell you. Second is take tests. Take as many tests as possible. You already have an INI-CET grand test series where you can take the grand test. A free grand test is available very, very soon. I'll tell you about it. But other than that, take as many tests as you can, and please take them in the INI-CET pattern. INI-CET pattern, you all know there is a +1 and a -1/3. So in this pattern, 200 questions, 3 hours. In this pattern, take the test. If you have taken 5 tests, take them again. If you have done it 2 times, do it for the 3rd time. Do as many tests as you can. That's a second very important strategy. This is the last 3 weeks. If you give 2 to 3 tests every week, imagine by the time you are giving your exam, you will have given around 10 tests. And that will really bring your rank from 200 to 20 or from 20 to 2. So take as many tests as you can, because that will help you rule out, that will make your speed faster, that will make you more accurate towards an answer. How do you take a test? So when you take a test, the questions which you are sure of, you know that this is the answer, I'm very sure of it. Mark the answer, move on. Whatever answers you have marked by fluke, whatever answers you have marked correct by chance, they are the most risky questions. So please go back and read the explanations. And obviously the questions which you have done wrong, go back and read the explanations. It is very, very important to understand. AIMS or INI-CET is a test of concepts. So wherever you feel that your concepts are not clear, you have answered the question but you don't know why, you've just mucked up the answer, or if your answer is wrong, go back to the explanation, read it thoroughly to understand, because in the exam, the same topic will be repeated, not necessarily the same question. For example, if this time they have asked a question on internal derangement, maybe next time they will ask a question on internal derangement classification. Next time they will ask a question on internal derangement treatment, maybe a mitic suture. So the topic is repeated. It's not necessary that the same question is repeated. It's always that the topic is repeated. And how will you know which is the important topic? By the test. So that is the second important point. Take tests. And the third is ST, which is save time. And when I say save time is both for the preparation part and for the exam part. Okay, so when you take the exam, there will be 2 types of questions. Okay, there will be a single best answer type. Okay, and it can even be an image based question, which is very, very easy, and you can just look at the image and quickly you can answer. Or it can be a multiple correct answer type. Okay, so these are the 2 types of questions that will be asked in INI-CET. The multiple correct answer type, or even the numericals, or the clinical scenario based questions. Okay, so these are broadly the 2 types of questions: the single correct answer, the single best answer type, and the multiple correct answer type. Now the type 1 questions will be answered within 10 to 15 seconds. You will only need 10 to 15 seconds to answer these questions at the max. When you read the question, halfway through you will know the answer. And that is the time when you start having confidence. So in 10 to 15 seconds, you will be able to answer. Whatever time you save, all right, you have 180 minutes and 200 questions. So roughly you have around 1 minute per question. Okay, actually less, around 54 seconds. But even if I consider 50 seconds per question, if you have 50 seconds per question, you are answering some questions within 10 to 15 seconds. Whatever time you save, you have to use that time in the type 2 questions. The multiple correct options, where you have to read all the options, you have to think whether it is right or wrong, you have to match the correct answer with the A, B, C, D options available to you, and then you have to mark. Or the numerical based questions, like when you have to calculate, say you have to calculate an odds ratio or you have to calculate a dose of lignocaine. So whenever there is a numerical, it will take time. Whenever there is a clinical scenario, so maybe they give you a CT scan of a pathology and they ask you to make a diagnosis or the test required or the treatment. So you have to see the radiograph, identify the pathology, make a diagnosis, come to the right treatment plan. Okay, so these questions will take time. They will take anywhere around 40 to 50 to 70 seconds. So you have to save time. Save time in the single best answer type questions, image based questions, and use that time in the longer questions. And why am I telling you this now? Because when you take your tests, that time only you have to practice the ST strategy. If you think, oh, exam mein dekh lenge, it will not be possible. You have to practice this saving time strategy in the practice tests that you are doing right now. All right. So save time and practice the procedure of saving time, because you will not know it suddenly. So these are the 3 most important points you have to remember as you spend the next 3 weeks. Next, revise 2 times. How will you be able to revise 2 times? What is the most important that you have to revise? And the most important is the previous year questions. Most of you have done the INI and NEET PYQs. Now here we will only focus on the INI-CET PYQs from the year 2014 to 2024 May. All those who are DBMCI students, you already have the access to the latest INI-CET paper, which is the May 24 paper. It's there on the app. The revision or the recall paper is there on YouTube. Those who are not enrolled, you also have access to the paper. And last 10-year papers are the most important resource for your exam. 70 to 80% questions will be from repeated topics. I don't like to call it a repeat question because the question can be twisted, the options can be twisted, but the topic will be the same. So 70 to 80% questions in the upcoming exam will be from the PYQ section. And just if you do the repeat questions correct, you will be a top 10 ranker at INI. It's not easy to make all the repeat questions right. Okay, people make mistakes, people make silly mistakes, a lot of mistakes in the repeat questions also. And just by doing the repeat questions correctly, you have a good chance of selections. So revise your PYQs at least 2 times. If you have already done it, you know the questions which you are forgetting. You have marked them, you have put them in your custom question bank. Just revise those questions which you are forgetting. Okay? And other than that, if you have made any comprehensive notes, like if you have made a small diary, which I always recommend, and make a small diary or a book where you revise the things, they keep writing the things which you're forgetting again and again. Important tables, important flowcharts. If you have made that diary, you can go through that now. this is the time to go through your last minute notes. Those who do not have these last minute notes, DBMCI has given every subject notes in a very, very crisp manner. You can go through them, or if you have made your own notes, nothing is better than that. Alright? So revise the PYQs at least 2 times. If you can do it more, it'll be great. Otherwise, at least 2 times, revise all the PYQs. The ones that you're forgetting, you can revise them more. So that is the point 2. And what is the one mantra? One mantra that is going to help you to get selected in exam is the basic, simple, easy, repeat questions will going to decide your rank. They are going to decide your rank. Not the difficult, out of syllabus, very tough, extremely difficult questions. They never ever decide your selection. 60 to 70% questions will be easy to moderate. Okay, they will be easy to moderate, which you have read, you have studied, you have done practically. 30% questions will be tough, and it is never ever the tough questions which will decide your selection in INI-CET. It is always the easy questions which we pay less attention to. We think that, oh, we don't know orthognathic surgery, we should know distraction, we should know cleft. First, you have to know exodontia. First, you have to know local anesthesia. First, you have to know basic pathologies. Then jump into the difficult questions, because some questions are purposefully put in the exam to raise the bar of the exam, to raise the level of the exam. Okay, and purposefully they are made to be really difficult. Okay, so that it's not a very easy exam. And it is not these questions. These will be tough even for the first ranker. Even if the first ranker comes and sits, even he or she will not be able to answer those questions. They will either leave it or mark it correct by fluke or mark it wrong. So it is not these tough questions which decide your rank. So bache, please focus on easy, simple, straightforward, repeat questions. Definitions, classifications, terminologies, treatment options, diagnostic modalities, simple things which you have done, which you have read, which you see in the clinical practice. They will decide whether you are a topper and you get a seat in INI or not. Alright, so this is the 3-2-1 strategy. Focus on your strengths, focus on taking more tests. In these tests, learn how to save time. Revise the PYQs 2 times. If you can go back and revise from 2010, it will be really helpful. Alright, if you can just go back and revise from 2010, it will be helpful. But since we know that INI-CET focuses more on the latest trends, INI always focuses on the latest trends, and latest is not later than 10 years. So first of all, focus on 14 to 24. Only if you have done that perfectly, if you have more time, you can go backwards. Otherwise, start from 2024 and go retrograde. 24, 23, 22, 21, like that. Do the latest years first and then go backwards. Okay? And remember, the easy questions will always decide whether you're anchor or not. For all of you, on 25th October, we are going to have our All India free mock, which all of you can give. This will be simulating the exact pattern of the INI-CET exam. You will be given an All India ranking that simulates your ranking in the exam. It's a very good way to prepare. It's a very good way to understand the level of your preparation. You can all fill the Google form to register it. The test, like the main exam, will only be taken on the egurukulapp.com website through the laptop or the desktop, not through the mobile, because we all want you to sit in front of a screen just like you sit in the main exam. So sit in front of the screen, a laptop or a desktop, register for free and take this test. All right. You will also be given a discussion of each and every question of each and every subject by the original guru of that subject. So you can all avail this opportunity of the free All India mock, which is live for 3 days, 25th to 28th of October. All right. So you can all take this exam, and we are open to doubts. If anybody wants to ask anything about strategy, I can answer your questions. You can all put your doubts in the chat box. I am not able to see the chat somehow. Okay. So if somebody has any doubts regarding INI-CET preparation, okay, all right. A lot of doubts here. Okay. When will we get our NEET Olympiad result? It's not a topic for this platform, beta. You will get it soon whenever the results are out. It's not a topic for discussion at this platform, dear Florence. Shiv Bale. So Shiv Bale is saying that he's filled the form with one category, and can it be changed now? So once you have registered permanently, you cannot change any details. All right, but still you can go through the I'm not sure about what you're wanting to ask me. I think you're trying to ask me that in payment you want to change the category. If you have filled the form with one category, after payment you cannot change the category of your, whether it's general or PWD or whatever. So after payment you cannot change your category. All right, that's not an option. Before payment you have all the options to edit your form, but after payment, of course you can't change it. All right, because you're registered. But that's why they give you many days to make those changes, and after payment obviously you can't make any changes. So Dr. Shiv, you can't make those changes now. Okay. Anxiety before the exam is too much. So Dhanashri, it's all a game about self-control. Okay. Everybody is at your same stage. ऐसा कोई भी नहीं है कि जिसने जो 5 साल से पढ़ रहा है. There is nobody who's studying since 10 years or 12 years. Everybody is either prepared for few months or 1 year or maybe 1.5 years or maximum 2 years. Okay. So they are all at your level. And believe me, the more attempts you give, the more anxious you become. It's all about having a balance. It's not the end of the world. Okay. INI-CET or NEET, they are very big exams and very important exams. What if you're not selected? You're still a specialist, right? You're still a dental surgeon. You can have your own practice. You can do 10 million things that not everybody can do, right? So don't make the exam bigger than life. Yes, it's a big exam. It's a very important exam, but it's not larger than life. All right? It's all about striking a balance. You may be best prepared or anybody who is very good prepared, but just if there is no stability here or no calmness here, maybe you don't perform that good on the day of exam. So just relax. Tell yourself it's just an exam which happens every 6 months. This is an opportunity. You won't believe I had juniors who were doing second year PG in pedodontics in AIIMS Delhi, and they just kept giving the exam every year because they wanted oral surgery. And in the second year of their post-graduation, that is after completing 3 terms of 6 months, they gave AIIMS exam, and on the 3rd attempt they got selected. And they left pedo in the second year of PG and starts with oral surgery now. So they have an additional anxiety that what will the HOD think or whatever. Another example I have, I will not take names here, but a postgraduate in PGI Chandigarh, wanted to come to AIMS Delhi. He gave his exam, his thesis was submitted. He was in his third year, exam going. He gave the INI-CET again and he got selected. So he took up oral surgery in AIMS Delhi. So many such examples. Alright. Anxiety is just a state of mind. If you are well prepared, if you have given tests, you will be confident. Anxious is the one who is less prepared. So prepare well, okay? Anxiety will go. Alright? So, Dr. Gaur, you can ask your question here. I hope that answers your question, Dhanashri. Okay. Aparajita says, I am confused and clueless just 1 week before exam, how to revise. I've just told you how to revise, alright? So, I hope this strategy helps you. Whatever subjects are your strength, focus more on that, give more tests. So, whatever strategy I've told you, this is the best strategy you can follow 1, 2 or 3 weeks before exam. Should we focus more on the clinicals? So Tanisha, earlier it was that, dental clinical subjects were a majority of chunk in the INI-CET exam. Even today, the clinical subjects have a very big importance. Alright, having said that, you can't leave the basic questions, the basic subjects. You can't leave anatomy, you can't leave general medicine, you can't leave anesthesia, you can't leave pharmacology. These 4 subjects in that order, you can't leave. Alright, I'm not saying that biochem is not important, or physio is not important, or pathomicro is not important. Everything is important. Question can be asked from anywhere. So, apart from dental clinical subjects, you should do anatomy, pharmacology, medicine, and these basic subjects also very, very nicely. Alright, so just don't leave anything, ideally. But if you have to focus more on these subjects. I watched this live just few minutes ago. Where will I get that Google form to attend the mock test? So Hariharan, the Google form will be available here after this session. It will be uploaded. There will be a link there and you can all click that link and here it is. So in the chat box, you can see the link to fill the Google form. So all those who want to fill it here, you can just click that link and fill the form. Alright, even after the session is over, the link will be pasted and you can all click it to fill the Google form. Alright, so I think great Gaur Gaming. If you have a doubt, you can ask me now. Otherwise, we'll wind up the session. And listen, don't worry, okay? Most of the people who get selected in the INI-CET are the ones who are very, very chill. Who said, okay, chalo dekhte hain, kya hota hai exam mein. Let's go and see. Let's go and explore. Let's see how it goes. They are not very worried people. They are chill people, okay? Most of them who are selected, they are just chill. Let's see. They are not anxious. They are not apprehensive. Nahi hoga to kya hoga? Arey koi baat nahi. Nahi hoga to there are a lot of things that you can do. So just chill. Alright, just chill. Just do what the best you can do. Just do your karma. Phal, God will give according to your preparation. Okay, the results will be there according to your preparation. Just chill, study hard, work hard, follow the strategy and leave the rest to God. Alright? Alright, so I think with this, we've answered most of the questions and I wish all the best to all of you. If you still have any doubts, you can connect with me in the DBMCI MDS Premier Telegram group. The enrolled students, you have your group. The non-enrolled students, you can also find the DBMCI MDS Premier group. You can tag me, Dr. Himani Joshi, and ask any doubts that you have regarding your preparation. Alright, we are also available on Instagram, Facebook, and YouTube. So wherever you want, you can find us and ask us anything you want. Alright, so Tanisha is asking me, should we focus on PYQ repeats or revision? Both are the same thing, right? Revision is of the PYQs. So, all the best to all of you for INI-CET November.